Your thyroid is a gland about the size of a walnut, sitting at the base of your neck, and it quietly controls almost every system in your body. Your metabolism, your heart rate, your body temperature, even your mood. Which is exactly why, when something goes wrong with it, the symptoms don't look like a thyroid problem at all. They look like 100 unrelated things: being cold all the time, gaining weight for no reason, feeling anxious out of nowhere. Today we're covering 6 signs your thyroid might be struggling, including one visible sign most people notice in the mirror for months before ever connecting it to their thyroid, and a bonus sign at the end tied to your heart rate that almost nobody thinks to mention to a doctor. Let's get into it. Here's what makes thyroid issues some of the most commonly misdiagnosed conditions out there. This one small gland produces hormones that essentially set the speed your entire body runs at. Too little of that hormone and everything slows down: your energy, your digestion, even your thinking. Too much of it and everything speeds up: your heart rate, your anxiety, your metabolism. That's why two people with thyroid problems can have almost opposite symptoms. One person feels exhausted and cold all the time. Another feels wired, anxious, and can't stop losing weight. Both are thyroid issues. Both get missed for years because the symptoms don't obviously point to the same gland. In fact, some estimates suggest as many as 60% of people with a thyroid condition don't know they have one. Stick with us, because sign #5 is something you can actually see on your own body. And the bonus sign at the end is one cardiologists sometimes catch before endocrinologists do. How this actually works. Before the list, here's the short version of what's happening, because it makes every sign click into place. Your thyroid produces hormones that travel through your blood and tell your cells how fast to work, how fast to burn energy, how fast to regenerate, how fast your heart beats. When your thyroid produces too little hormone, that's called hypothyroidism, and your whole body effectively slows down. When it produces too much, that's hyperthyroidism, and your body speeds up. Most of the signs on this list are actually two-sided. We'll flag which direction each one tends to point, because that distinction genuinely matters for what's happening inside you. Let's go through them. 1. Fatigue that doesn't match your sleep. This is usually the very first sign people notice, and usually the last one they connect to their thyroid. With an underactive thyroid, hypothyroidism, your body's cells simply aren't getting the signal to produce energy efficiently, so you can sleep a full 8 hours and still wake up feeling like you barely slept at all. The key difference from normal tiredness: this fatigue often gets worse throughout the day rather than improving with rest, and coffee barely makes a dent in it. People frequently describe it as feeling like they're moving through fog rather than simply sleepy. Sign 2. Unexplained weight change in either direction. Here's where the two-sided nature of thyroid problems becomes really clear. With hypothyroidism, your metabolism slows down, and you can gain weight even without changing your diet, sometimes 10 to 15 pounds over a few months. With hyperthyroidism, the opposite happens. Your metabolism speeds up so much that you can lose weight rapidly, even while eating normally, or even eating more than usual. The detail that matters here isn't the direction, it's the fact that it's happening without any change in diet or exercise. That mismatch between your habits and the scale is the actual signal, regardless of which way the number moves. 3. Feeling unusually cold or unusually hot. Your thyroid hormone directly regulates your body's internal thermostat. With hypothyroidism, that thermostat runs low. People often describe needing a sweater indoors when everyone else is comfortable, or having consistently cold hands and feet. With hyperthyroidism, it runs the opposite way: feeling overheated, sweating more than usual, even in a cool room. What makes this sign easy to miss is that it's so easy to blame on something else: the office air conditioning, the season, just running cold as a personality trait. But if it's a noticeable, persistent shift from how your body used to regulate temperature, that's worth paying attention to. Sign 4. Hair thinning or unusual hair loss. Thyroid hormone plays a direct role in the hair growth cycle. When thyroid hormone levels are off, in either direction, hair follicles can shift into a resting phase too early, leading to noticeably increased shedding, thinning, particularly at the outer edges of the eyebrows in some cases. The distinguishing detail here is the pattern. It's usually diffuse thinning across the whole scalp rather than a specific bald patch, and it often shows up 2 to 3 months after a hormone shift begins, which is part of why people don't connect it to their thyroid. The hair loss lags behind the actual hormone change, so it feels like it's coming out of nowhere. Sign 5. Swelling at the base of your neck. This is the visible sign we teased at the start. It's called a goiter, a visible swelling at the base of the neck, caused by the thyroid gland itself enlarging. It can happen with an underactive or overactive thyroid, and it can range from barely noticeable to clearly visible. What makes this sign genuinely important is that, like the skin sign we covered in a previous video, it's something you can observe directly, without any blood work. If you've noticed a subtle fullness or swelling at the front of your neck, especially one that's more noticeable when you swallow or tilt your head back, that's a specific physical detail worth mentioning to a doctor. Sign 6. Mood changes, anxiety, or low mood. Thyroid hormone has a direct effect on brain chemistry and neurotransmitter activity. With hyperthyroidism, this commonly shows up as anxiety, irritability, or a restless, on-edge feeling that doesn't match the actual circumstances of someone's day. With hypothyroidism, it more often shows up as a flat, low mood or a mental fog that can resemble depression. This is one of the most commonly missed signs on this entire list, because mood changes get attributed to stress, life circumstances, or mental health alone, rarely to a gland at the base of the neck. When mood changes show up alongside any of the physical signs we've covered, fatigue, weight change, temperature sensitivity, that combination is worth mentioning together, not separately, at a doctor's visit. Bonus sign. The one cardiologists sometimes catch first. Remember the bonus sign we teased in the hook, the one tied to your heart rate? Here it is, a noticeably fast, slow, or irregular heartbeat, sometimes described as heart palpitations. Thyroid hormone directly regulates heart rate. With hyperthyroidism, this often means a persistently fast resting heart rate, or a fluttering racing sensation in the chest, even at rest. With hypothyroidism, it can mean the opposite, an unusually slow heart rate. Here's why this one is worth knowing. Some patients actually visit a cardiologist first, describing palpitations or a racing heart, before anyone thinks to check their thyroid. It's a genuine cross-specialty blind spot. Heart symptoms get worked up as a heart problem when the root cause is sitting in the neck the whole time. Here's the pattern worth remembering. Notice how these signs actually split into 2 directions. Fatigue, weight gain, feeling cold, and low mood tend to cluster together and point toward an underactive thyroid. A racing heart, unexplained weight loss, feeling overheated, and anxiety tend to cluster together and point toward an overactive thyroid. And 2 signs, hair thinning and neck swelling, can show up with either direction. No single sign on its own confirms anything, but if 2 or 3 signs from the same cluster show up together, that's a meaningfully different situation than one isolated symptom. The good news, thyroid conditions are also some of the most reliably treatable conditions once identified, often with a single daily medication and a simple blood test to monitor it. The hard part isn't treating it, it's connecting these seemingly unrelated signs back to one small gland in the first place. This video is for awareness, not diagnosis. If 2 or more of these signs sound familiar, a simple thyroid blood panel from a doctor is the right next step. If this helped you connect some dots, hit subscribe. We cover early warning signs like this every week, including our video on the early signs of diabetes most people miss, right here. And if any of these signs sound familiar to you, drop a comment below and let us know which one surprised you most. You might help someone else watching finally connect symptoms they've had for years. See you in the next one.